So we are back into our regular routine. I gave you yesterday the study guide for the chapter. I put up onto RenWeb this morning both the images slideshow, which is what I'm going to use exclusively in class. I also put up the lecture PowerPoint. Because I've added some slides, and there's not all the stuff that we talk about is not in the lecture PowerPoint, but some of you like that, so it's up there for you as well. Okay, pretty straightforward as far as what I'm looking for you to know. We'll talk about anatomy, we'll talk about physiology. I compiled your questions yesterday, both your questions and the last class and the second classes together. Some good questions. Very, very solid. Some of them we're going to answer just as we're going through these pieces. But once we get through the material, then we'll spend, sometimes it's one day, sometimes it's 2 days, because often one question brings another question, brings another question. So if you have more things that come to mind, jot them down. If you feel comfortable giving it to me, great. If not, I will open up Schoology again, not Schoology, Socrative again to let you put them in anonymously. Excuse me. It used to be I would just kind of take them, just like hands. All right, you got any questions? And you always got some interesting things. But this at least gives me some time to prepare if there's something that I've been asked that I don't know about. Okay. So we do start with the guys because it's much easier, frankly. So we start there. Most of us fairly simple. Okay. And they always roll this side profile. They always roll this. What plane would this be? Would this be sagittal? It's been too long now, right? Yeah, slicing right down the middle, right? Good, good, good. So that's what you're looking at from the side here. And we're gonna roll from the top and just kind of work our way around here. And by the way, this is one of the diagrams you need to know, right? It's on page 507. There's two different ones for the female, but just one for the guys. Okay, so on top here, you have the urinary bladder. And again, what I like about doing this after we do our cats is hopefully as I'm mentioning these pieces, you're thinking in your mind where these different things were, right, on your cat. I loved, by the way, there was a group that was working on the model that we have in the lab. It's really old. It kind of doesn't go back together very well. But I love that people were looking at that saying, oh, yeah, no, I know these pieces. I know where this goes. I know this is here. And that's exactly why we do the cats, right? Those, you all did very, very nicely. Those grades are in RenWeb as well. So the bladder on top, these tubes here are called the ureters. Does anyone know where those go to? Like what fills the bladder? Urine, obviously. Where does that come from? Not the intestines, the kidneys. The kidneys are filtering the blood, and this is the waste products that are coming from that are then sent down into the bladder, which we'll get to that. That's another section we'll talk about the urinary system. The bladder, okay, you can see that they have this is they call it the superior pubic ramus. It's basically your hips, right? Not the ilium. We're talking more about the pubis bones. Remember, there's the ilium and the pubis and the ischium, right? Those three bones that make up our hips, right? So that's what you're seeing here. You're seeing basically that pubic bone that's been cut so you can see the other organs around it. But it does run right down the center there. Some other pieces on the top that we get here. Here's our large intestine, which if you were looking at, so this is a side view, this is a sagittal view. If you're looking from the anterior side, and you saw this on the cats, but I want to make sure you see it as I'm drawing it here. You've got all the small intestines, right? All the small intestines, right? Here's the stomach that's here, right? And they attach in the small intestines. And they go around and around and around and around. And then over here is where it comes out. And you get large intestine that goes up and around, down, and out. So this is the down and out. Obviously, the anus being the end of the line as far as the large intestine goes. This straight part right here, does anyone know what they call that part of the large intestine? The rectum. What does rect mean? straight. It's because it's a straight part. Okay? Really all goes back to it. And I'm sure I've told you this, but in this chapter especially, there's some very interesting, what's the word I want? Vocabulary. And at the beginning of the chapter, like on page 506, there are these aids to understanding words, and it's showing you these different roots, these different suffixes or prefixes, and you can see where they come from. Anyway, I just think it's very helpful, rather than just being a word you're trying to memorize to see what it means in the Latin. Okay, so there's the large intestine coming down there. So really only 2 significant openings as far as the guys go. Many more on the ladies, but only 2 for the guys. Coming the anus, and then coming out of the penis, which is the urethra. The urethra is that tube that basically travels from the bladder down and out. Okay? Whereas the ladies have 2 different tubes, one the vagina, one the urethra. The guys put all that together. It's one, simple, easy, right? So therefore, you've got 2 routes to get things out, as far as out of that urethra. You have the route that goes into the bladder itself. But then can you see there's also this route that starts down here in the testes and goes down and around and into the urethra. And you've got this junction, like this cross rock of these 2 different pieces coming together into one. Okay? Those tubes, that tube that comes from the testes, that is, well, this top part is called the epididymis. Kind of the squiggly part here. And then the tube that actually carries it around is called the ductus deferens, or the vas deferens. Have you ever heard of a vasectomy? What does ectomy mean? Does anyone know? Cut. Yeah, not off, but cut. Okay? Yeah, cut. So a vasectomy means I take those vas, that tube, and I cut it. Why? To sterilize, to keep you from allowing, because what's formed here in the testes? Sperm. That is the primary work of these testes, is to produce sperm. And so if I put a clip or a cut or a block, like I literally cut the tube and sew the ends together, can the sperm get out? No. And they just reabsorb. It's not like they build up some huge pressure until they explode. No. It reabsorbs. Shh. Talking about exploding testicles. Suddenly you're all talking. That's fine.
No, you said so the sperm goes through the bladder and then...
No, it doesn't actually make it through the bladder. If you look at the picture, it kind of all runs together up here. But there's a tube that runs all the way around the bladder and then comes here into the urethra. Okay? No, thankfully. Not that far. Shh. You guys are all with me? Well, shh. Some good questions. He's asking why can't it just go straight up? You'll see there's other pieces that get added to it. Okay? What you think of as semen is not simply just sperm. That's what a lot of people think. But there's a whole lot of other things that are involved. And we'll talk about that. Okay? Let's see, other big pieces. Of course, you have the penis. The end of the penis they call the glans. The glans. This piece on the outside called the prepuce, or P-R-E-P-U-C-E, or the foreskin. If you have seen or know of someone who has had, why is this not, it's not my updated PowerPoint. Sorry, I got to see. I updated my PowerPoint, and it's not here. That will make me very upset if I didn't actually save it. I'm really annoyed. I'm sorry, I'm not sure what happened to my other pictures. Now, if you're on you'll get to watch me do this live. Okay, so circumcision, this is the one that I had. Yeah, they're giving you examples of what they're doing. Okay, so circumcision is, there's that gland, that foreskin, the prepuce on your diagram. That is, it's simply just a little layer of epithelial tissue. Okay? And for a circumcision, they literally just cut that layer of skin off the outside, which reveals the glands of the penis. How prominent is it? Depends on where you're at in the world. If you're a Muslim, you're about 80% likely to have a circumcised penis. That's just a very common thing there. Because remember Abraham, foreskin cut off, right? That's where this kind of all began back in the day. Nowadays, the statistics are hugely, like some say 30%, some say 80%. Okay, I think it depends on where you live. The most deciding factor, if you're a guy, as to whether or not you are circumcised, is if your dad is. If your dad is, and he's a part of your life, you most likely are. If he wasn't, and he's a part of your life, you most likely are not as well. That's usually how it decides. Medical benefits, one way or the other, you can find in Passion to Please on the internet both directions. Okay, the College of Urology, these doctors who specialize in this, basically say, it's up to you, as far as it's good or it's not. There is the potential of that, but it's not. All it takes is a little bit of care when you're washing yourself. It's not like a no, it's not. So there was a thought that was the case, but no. It's basically, like I said, if your dad is, you are. If your dad's not, you usually aren't as a guy. But certainly a conversation worth having. It's usually done a day or two after the baby is born. Usually, I mean, they literally performed a couple million of these surgeries every year. It's a very simple, very quick procedure. Usually no significant problems. Can there be infection? Those things, absolutely, it does happen. But for the most part, fairly rare. The baby cries a bit, put some cream on, life is good. Okay? But it does give you some thoughts to say, wow, in the Bible where they like circumcise these older guys, I mean, can you imagine that? But not, that's why they're laying around for days and then they come and kill them, right? You remember the story in the Bible? Yeah, so would not be fun. Okay. What else have we not talked about? Oh, two different parts of the penis as far as what it's made out of. The corpus cavernosum and the corpus spongiosum. Okay? Spongiosum, what does that sound like? Well, like a sponge, right? So that's what it is. It's this spongy tissue. Cavernosum, what does that sound like? Like a cavern, like a cave, right? This is the tissue, and it's this purple on this diagram, though it's not really purple in real life, but that's how they've shown it. It's not, truthfully. That is the tissue that allows for an erection to occur. What is an erection? Simply blood that is flowing into the penis that is stopped from flowing out. There's a set of muscles that constrict on the bottom here that basically cut off the veins that would take the blood flow out, right? So if blood's flowing in, you've got this tissue, this cavernosum tissue. It's basically like open rooms that the blood can come into and allow it to expand. Does that make sense? Yeah. And again, that's mostly along into the open room door. Yeah. This spongiosum tissue is more along the underside of the penis, and basically most of that shaft, the length of it, is this cavernosum tissue. Okay? A couple other little pieces that we have not mentioned here. The seminal vesicle and the bulbourethral gland. Seminal, does that sound like another word maybe you know? Like seminary, is that what you said? Yeah, no, it's good. It's good, not the same meaning. How about semen? You've heard that term, right? Sure. This is the seminal vesicle. No, it does. It does. It's a very good point. I'd have to look to see the root of those two words. That's interesting. I don't know. Yeah. So the seminal vesicle is producing the majority, even. I can't say it's majority. Is it majority more than the sperm itself? I think it is. The majority of what makes up semen comes from that seminal vesicle. It's producing fluid. Where is that in your textbook? Where is seminal? It should be on these next couple of pages here from the picture. Yeah. 510. Okay. Good. Yes. Okay. And each of these guys is producing, again, this fluid, this seminal fluid. What's in it? Like why? Take a peek. Read. So I know you did this for your questions. I know many of you have already worked on a number of those. What is that seminal fluid? What is it composed of? Fructose. What is fructose? Sugar. Why in the world would you want to have this fructose in the semen? To the sperm. So the sperm have energy. Right? Because the point, no, it's very solid. The point of it is that it's supposed to get up to the egg, right? Sure. Okay? It's cool. It's very cool. It does not make the semen taste sweet. It does not cause that. It does not cause that. It's good. It's good. I knew you were going there. I knew you were going there. Good, good, good. It's good. It's good. It's good. We good? It's the first major laugh. It's good. Got it out of the way, Daniel. That's good. It's good. It's good. It's good. Come back to me. Come back to me. Okay. So you have semen is composed of the sperm. Again, we'll talk much more about the sperm in a minute here. But with the sperm, the fluid from the seminal vesicle, and there's also a little bit that comes from this bulbourethral gland. The bulbourethral gland, its job is to secrete a lubricating fluid before ejaculation, because the semen comes at ejaculation. This is fluid that would come to help lubricate the end of the penis before ejaculation. Pre-cum, if you've heard that term, that would be what you're speaking of. Okay? And it's lubrication. That's what the point of that is for lubrication. Okay? So again, semen we made up of, this is a great test question, right? These three pieces, right? Sperm from the testes, that seminal fluid from the seminal vesicle, and the fluid from the bulbourethral gland. Do ladies have these same things? Yes, they do. We'll talk about them. Okay? Any questions so far? Some folk ask about the prostate. Have you heard that term before? Oh, don't get older than 40. You got to have your prostate checked, right? Put the glove on. Okay, here we go. Right? That's what they're checking. And again, this is another piece. Well, let's take a peek. It's in your book. They talk about the prostate gland, right? There again, still on page 510. I ask you, what does it do? Yeah, I mean it's about like this size. Yeah. What does the the prostate gland do? What's the point of it? It does get cancer. That's why we check it.
It secretes a thin milky fluid with an alkaline pH.
Good. So that's also part of the semen, right? Does anybody know why in the world? So like if you were to test semen on a pH scale, it would be very alkaline. Anybody have any idea why? Remember acidic, alkaline, right? Vaginas are very acidic. Why? No. It's a good thought, though. That should be neutral. Urine should be neutral. To kill off what? Bacteria. Yeah. We'll talk more about this, but in truth, the vagina is meant to be a very harsh environment. Okay? Because again, it's an open tube going into the body. If this was a nice, happy place to be, you would die very quickly, right? As far as germs and those kind of things go. Right? Okay? Yes. So if the vagina is very acidic, why would you want semen to be very alkaline? To neutralize it. Yeah, to neutralize it. Okay? So again, so that way you get the semen allowed to go through. All of these things are to allow that semen to get into the vagina, to move up and find the egg. That's what all these pieces are for. Okay? So again, the 4 pieces. Stay with me. Prostate gland, seminal vesicle, bulbourethral gland, and the testes. These are producing the 4 parts, the 4 things that make up semen. Okay? Any questions here? We've pretty well covered all of the anatomy. Any questions on that? One question that always comes up at some point, because we said that the urethra, right, this tube that comes out the end of the penis that goes up here, that it carries both things, right? Urine and also the semen. Like, can they carry both at the same time? Like, truthfully, like what if you were wanting to urinate and instead semen came out? Or the opposite, right?
The opposite.
It actually cannot. Shh, stay with me, guys. So again, stay with me. So truthfully, you cannot do both simultaneously. There are muscles. So I'm hoping that today you'll get all the giggles out. All right. Again, I don't mind somebody. You just stay focused with me. Okay. If you need to change seats or move someplace else, I'm fine with that. Okay. There are smooth muscles that, when ejaculation is imminent, as the penis gets aroused, it basically cuts off, not cut off like with a knife, but it blocks that tube coming from the bladder down into the urethra to allow the flow of the semen to come. After ejaculation, there's a period of time where, again, those muscles are still present, they're still tight, and it takes some time for them to relax and allow the urine to pass through. So it's not something you have to be concerned that, oh, what if, the wrong thing comes out when I didn't want that. No. The body takes care of that. Okay? Any other questions, male anatomy-wise? Oh, I will address this one. This is one of the questions that someone had asked. Have you ever seen these commercials on late night TV about ways to enhance the length? Take this Enzyte, or do this, or here's this machine that will make you longer. Right? It doesn't work. It doesn't work. There is no pills. There are no machines that will help increase the length. In truth, oftentimes what can happen is you can damage some of these corpus cavernosum cells, which then affects erections. So there's really nothing that what you got, you got. There are ways that there are some surgical things that can be done. You see that there are these ligaments that are right here. They don't show them very well, but these ligaments that are right there that basically hold the top part of the penis, those can be cut, which then allows it to hang further, but there are other problems with that as well. People are like obsessed with size. Truthfully, it doesn't matter. Truthfully. I'm just telling you. Okay? Other questions here? Yes? Shh. Erectile dysfunction is a great question. There are 1,000 things that go into that. It can be that simply the blood flow is messed up. That's what most of your Cialis, Viagra, these kind of things are dealing with that, trying to increase the blood flow to the area. It can be a psychological thing. Maybe you've been raped, or maybe there's some other things that have happened that will not allow you to have an an erection. There can be, there's a number of different things that go into it. There is oftentimes, as you get older, there is some issues with blood flow. If you stay healthy, you stay active, usually it's not too bad. But that's why these medications are there. Is there one that helps with the ladies? Not yet. Someone discovers that, that's like the golden crown that's out there. All right. 140 is when we're done, right? Okay, if you have not read, have not done your questions, I'm encouraging you to go there. All right, Friday is when they're due.